how does Shasta County Public Health go about reporting COVID-19 deaths?
Sure. Shasta County reports COVID-19 deaths every workday on our current news page at shastaready.org. We also notify the media and other community partners, and also post the death rates and also other data on our social media.
Great. And what does the process look like for all of you who are reporting those COVID-19 deaths? Is it you just work with local doctors, or are you guys also working with the state?
Yeah, so public health uses two key sources of information to identify COVID-19 deaths. The first source is the Shasta County death certificates. That's our local information. And public health reviews all the death certificates and notes whether COVID-19 was listed as a cause of death by the attending physician, the patient's physician. And then the second source is a weekly report of COVID-19 deaths from the state of California. From there, public health and epidemiologists investigate all the deaths, and with the health officer, they confirm whether indeed they were COVID-19 death.
What information does Shasta County Public Health have access to in terms of the COVID-19 related deaths?
What do you mean by what type of information?
Yeah, so are you guys able to see the age, the name, if they were vaccinated, if they weren't vaccinated?
I see. I'm not sure all that's included in the reports, but Shasta County does not provide any information on individual cases that could identify a patient. This is just to be in compliance with the Health Insurance Portability Accountability Act that basically protects patient information from being disclosed. So we do our best to provide enough information to the community that will help them make educated decisions for themselves and their families, but without disclosing so much information that patients could be identified. Same thing with the vaccination status. When a person passes away from COVID-19, the person's vaccination status is confirmed by public health by using the state's immunization registration database.
And then for those people who may be wondering, why doesn't our local public health department disclose that information? Obviously, you guys do disclose how many deaths happened throughout the week and every day. But some have been, bringing up to us, why haven't our public health released if these people who have died are vaccinated or are not vaccinated?
We provide that information on our vaccination page at shastaready.org and on a regular basis so that people can see the vaccination rates for fully vaccinated people and partially vaccinated, but not individual cases, because that might be breaching some privacy issues. And also on top of that, daily reports don't provide stable data. It's much more helpful to get data within like a 7-day period or a 14-day period. That way the data is much more stable and meaningful for reporting.
But in terms of what information public health does not provide with COVID-19, again, what are those things that, again, you guys do not provide to the public that are, private information?
I think it'd be easier to say what we do provide, and that's basically age groups from 0 through 100, essentially. So we report the COVID cases by age groups to protect health, privacy. But other than that, we really don't report any other identifying information.
All right, Amy, thank you so very much. I appreciate you answering all my questions. Anything else that you would like for me and or the community know about?
Yeah, so the epidemiologists were kind enough to work with community relations to put together a video that's labeled, "How does a death become a COVID-19 death?" because it answers a lot of our frequently asked questions. And you can find that video on shastaready.org on our current news page or on YouTube. And our YouTube channel is Shasta HHSA. And it's a very informative video about how our team investigates a COVID-19 deaths.